Hi, my name is Sarah. I'm the student nurse. I'm going to be performing staple and suture removal. I'm going to do it in one video, and I'm just going to swap out the patients. So the first thing I'm going to do is verify the physician's order. I am going to gather my supplies, ensuring nothing's expired. For these supplies, I would get normal saline and gauze to clean the wound. And then I would also get either the suture removal kit, the staple removal kit, and then ensure that I also have steri strips. So the first thing I'm going to do, identify the patient using 2 identifiers, check the patient's allergies, provide privacy, perform hand hygiene, go in the room, explain the procedure to the patient after I verify their ID. And then if patient, that's it. I have all my supplies here. The suture removal kit, the staple remover kit, my steri strips, and of course I have my patient. I've already done my hand hygiene and applied clean gloves. I'm assessing the wound for redness, edema, ecchymosis, drainage, and approximation. It looks well approximated. So at this point, I'm opening my kit. I am grabbing the forceps with my non-dominant hand, and then I'm grabbing the scissors with my dominant hand. And what I would do is I would remove one suture at a time, grabbing the knot with the forceps, pulling gently upward, sliding the scissors underneath, cutting, pulling out, and then disposing. And then I would see how the skin reacted, making sure it's staying approximated. And then I would apply a steri strip in the place of where I removed the suture. And then I would do like 1 inch and then 1 to 2 centimeters apart going up the wound, and being careful to only remove every other suture and applying the steri strip in between, and then I would work my way back up until they were all removed. And the reason I'm doing that is because if you remove all of them next to each other and it's no longer approximated, then I would notify the physician and stop removing them. So if at any time the skin's not staying approximated, I would stop removing, notify the provider that the wound didn't heal correctly. Then I would dispose of my gloves, do hand hygiene, and then I would document the procedure, how the wound looks, and how the patient tolerated it. Okay, and then for the staples, I would do the same steps that I did for the suture removal. So I would just ensure that the wound is clean, assess the wound for any redness, edema, ecchymosis, drainage, and approximation prior to removing. If it need cleaned a little bit, I would do the cleaning with the normal saline. I would then open my okay, so as I'm removing the staples, I'm going to do the same thing. I'm going to remove every other staple, and I'm going to grab a steri strip out of the steri strip packaging. Those are going to be pre-cut into the size and the length that I need, and after each staple removal, I'm going to apply steri strips in this place. I'm holding the steri strips, I'm holding the staple remover with the bell curving down. I'm going to scoop under the staple. I'm going to just clamp. It's removed. I'm going to remove the staple, apply my steri strip, and then I would move on to skip a staple and then move on to the next one. The same thing for the staples is every other staple, and then I would document how the patient tolerated the procedure, and then the appearance of the wound, ensuring that I stop if at any time the wound was no longer approximated. Dispose of all my dirty supplies, and then I would discard my gloves, discard anything else that's left behind, perform hand hygiene, and then of course go to my documentation, position the patient back in a safe position for comfort. Yeah, that's it. My non-dominant hand, I'm going to grab at the knot. Oh my